My name is Ogechi. I am part of the management team as well as the women's health team in Mayo University Hospital. So today we're going to discuss about the pelvic floor muscle, and I'm just going to show you some illustrations of the pelvic floor muscle. The pelvic floor is extremely important for both men and women, and we're going to just break it down so that people can get a good concept of this muscle. Because what we found, especially as physiotherapists working with women, is that some women don't get the grasp of where the muscle is, what the muscle does. So today I'm just going to break it down and try and explain it a little bit better. Okay, so this is the female pelvis, all right, and right in front here, that's your pubic bone in front, your pubic symphysis bone, and then right at the back, okay, is your sacrum right down to your tailbone, your coccyx, all right. So the pelvic floor muscle, okay, sits just like its name, it sits on the floor of the pelvis. So it sits the way my hand is sitting, all right. So if I just turn this upside down there, so that's how the pelvic floor muscle sits right at the pelvic outlet. We call this the pelvic outlet, and in here, the top here, we call the pelvic inlet. So if you think about it, the pelvic floor muscle sitting down there carries all the organs in the pelvis or within the pelvis, okay? So it carries the bladder in front, it carries the womb in the middle, and then it carries the back passage. So it carries all those organs in place. So as well as it's supporting the organs and carrying it, it also allows you to empty those organs. So every time your bladder is full and you need to go and empty your bladder, the pelvic floor muscle opens up as a door to help you empty your bladder. For the vaginal region, really when you're pregnant, okay, and during the second stage of delivery, when you're trying to push and get the baby out, the vaginal wall, which is part of the pelvic floor, as well as your perineum, opens and stretches for the delivery of the baby. And then finally, for the back passage, every time you need to go and empty your back passage, the pelvic floor again opens up for you to empty the back passage. So you could think about it as the pelvic floor having three doors. So one door that helps you empty your bladder, the other door that helps with the delivery for the second stage, the pushing stage, and then the last one for the back passage. So think about the pelvic floor as a trampoline. You know, when you buy a brand new trampoline, it's nice and bouncy, right? And then after a few years of jumping on the trampoline, it begins to weaken. So sometimes when there is weakness around that pelvic floor muscle, it can actually start posing as problems for women and men as well. So again, if a door isn't shut properly, okay, so let's say maybe the bladder door isn't shut properly, when you cough, when you sneeze, you may notice that you're wetting yourself. Sometimes when some women, that's what we call stress incontinence. So stress incontinence is when you cough, when you sneeze, when you lift anything heavy, any increase in what we call your intra-abdominal pressure can lead to stress incontinence. For urge incontinence would be maybe you just are not able to get to the toilet on time. When you get the urge to go, you just don't seem to be able to get to the toilet quickly. So same thing as the bladder, it could also occur with the back passage as well, where women, when they need to go and empty their back passage, they have to drop everything that they're doing, leave it all, and just rush to the toilet. And in some cases, some women don't make it to the toilet on time. Now, all these symptoms can be very, very, very embarrassing. Some women don't even talk about it. Some women hide it from their partners. Some women just become demoralized as a result of this. So hopefully now from this session, I'm going to teach you how to tighten your pelvic floor and strengthen that pelvic floor muscle so that it's nice and strong, and so that the doors are shut, and to help you improve your quality of life and get you back again into shape. So I'm just going to show you an illustration of the effect of coughing, okay? The effect of an increase in intra-abdominal pressure, either sneezing, in some cases heavy lifting, in some cases with women that suffer with constipation, how it can impact our pelvic floor muscle. Okay, so just give me a moment there. Okay, so this would be used as the weight. Okay, this would be about maybe 1.5 kg, so not that much really. All right, so I'm just going to place that into the pelvis. All right, and just notice what happens when you cough. So if you cough down, okay, with that weight, it drops down like that and comes back up again in some cases. And then you cough again or sneeze, it drops down again and comes back. So if you imagine over the years when there is all this dropping down and lifting up, which could happen with constipation, as I said, sometimes it could happen with delivery of the baby when you're pushing, okay? Heavy lifting. In some cases, if you're not doing the sit-ups right when you're trying to exercise, again, that could put pressure down, okay? So all those things can weaken the pelvic floor muscle over time. So it's extremely important for us to keep that pelvic floor nice and supported, all right? So that if there is any increase in the intra-abdominal pressure, that the pelvic floor is strong enough to withstand that. Okay, all right. So now, how do we do the pelvic floor exercise? All right, so if you think about it, there are three openings. Okay, there is the bladder opening, there is the vaginal opening, as well as the back passage. So imagine if you have three doors open. If you want to ensure that all the doors are shut and shut tightly, you have to shut all the doors, okay? So when you're doing your pelvic floor exercise, you must be able to shut the door of the bladder. You must be able to shut the door of the vaginal opening, and you also must be able to shut the door of the back passage, all right? But now the issue about these doors is that they are circular doors, okay? So they are like circles, okay? So you're thinking, okay, if a door is a circle, how would I be able to shut the door? Now I'm just going to show you another illustration with that, all right? So one moment. Okay, so this is a standard gym bag, all right? So if you have a look at it there, okay, nice and tight and firm, all right? But if you think about it, if this gym bag is opened and lax, all right, if I have anything stored inside this gym bag and I turn it upside down, which is the way the pelvic floor muscle sits, everything inside that gym bag will fall out, all right? So we want to make sure that nothing falls out of the pelvic floor muscle, okay? So whenever you're trying to tighten your pelvic floor muscle, what your aim is that you're trying to achieve is that you're trying to shut the door. You're trying to keep it nice and firm. You're trying to keep it nice and tight to keep whatever is in that gym bag or the pelvic floor muscle closed in, okay? So we're going to pick the bladder region. We'll start from the bladder. So the illustration we give really with regards to bladder is for you to imagine that you're trying to stop and start the flow of your urine, okay? So really you're trying to squeeze the opening of your bladder, okay? Right at the front of the bladder. So find the door of the bladder. And some women will be thinking, how on earth, okay, am I going to be able to isolate this? But we do have the capacity to do that. If you think about it, if you're busting to go with your bladder, to go and empty your bladder, your brain knows that the pressure will have to be at the front rather than at the back. And if you need to go and empty your back passage as well, the pressure is usually at the back. So the brain understands that pathway in most cases, okay? So think of that bladder door, the front door of the bladder, okay, close to that pubic bone that I was talking about. So close to the pubic bone, just right there, right close to the pubic bone. That's where your urethra sits, which is the bladder door. So your aim is to try and close that in. You're trying to stop and start the flow of your urine midstream. Now, that's only an imagination. We do not want you getting into the habit of stopping and starting the flow of your urine midstream when you're actually going emptying your bladder. We don't want your bladder to get used to that habit, okay? So just imagine that you're trying to stop and start the flow of your urine midstream. Okay, now we'll go towards the vaginal area, which is the middle door. Now with the middle door, again, similar, it's a circular door. Your aim is to try and bring all the bit of the vagina closed in. You know, if you imagine a jellyfish, you know, the way the jellyfish has all its tentacles, you know, when it's trying to, you know, it goes like that. So really that pulling up effect of that jellyfish is what you're trying to achieve, okay? So you're really trying to squeeze and shut the door. You're trying to squeeze and shut the door, okay? And then for the bladder, again, similar effect again for the bladder. We tell you to imagine you're trying to stop and start the flow of or stop and start the when if you get the urge to go and to pass wind, you want to try and stop the flow of that. Again, it's all the same technique because the muscles are circular. All right, similar technique to the bag, okay, exactly similar. All right, so think of that back passage again and you're trying to squeeze to shut the door, okay? So bladder, your aim is to try and imagine you're trying to stop and start the flow of your urine, okay? The vaginal region, again, that circular door, you're trying to close it in, or you're thinking of the tentacles of the jellyfish, really trying to pull up and close. And then for the back passage, as if you're trying to stop yourself from passing wind, okay? We always advise that you lie on the bed with your knees bent and your legs far apart, because at least when you're lying down, all your muscles are relaxed, and then you can focus on all those different scenarios that I've just explained there, okay? Now with the pelvic floor, there are two types of contractions that we get women to do, and men as well. So there's the fast contraction, and the fast contraction is a muscle, is a type of muscle fiber that comes in when you cough, when you sneeze, okay? So really, when we cough, when we sneeze, the pelvic floor muscle is supposed to just close, you know? So when you cough, a reflex is supposed to occur where your pelvic floor muscle just close to keep the door nice and shut. But when women have stress incontinence, that door doesn't close quickly, or before the door closes, there is a leak. So the fast exercise is also very important. So the same way I explained with your bladder, your womb, and your back passage. So for the fast exercises, so let's pick the bladder now. You tighten, let go, tighten, let go, tighten, let go, tighten, let go. Repeat that 5 times, repeat that 10 times, okay? So bladder, tighten, let go, tighten, let go, tighten, let go. Womb, tighten, let go, tighten, or the vaginal opening, tighten, let go, tighten, let go, tighten, let go. And then for the back passage as well, tighten, let go, tighten, let go, tighten, let go. So that's the fast one. So you could repeat 5 times and you could progress up to 10 times, okay? And then for the slow contraction, the slow contractions again are the ones that helps you. That's another fiber of the muscle that helps you carry the bladder throughout the day, helps you carry the womb throughout the day. If you're pregnant, it helps you carry the baby throughout the day and carries the back passage as well throughout the day. So with that one, okay, you're going to tighten and then you hold 1, 2, 3, 4, 5 and let go. Tighten again, hold 1, 2, 3, 4, 5 and let go. Now some people may only be able to hold for 2 seconds. Some of you may be able to hold for 3 seconds. Some of you may be able to hold for 9, 10 seconds. So every woman varies. So see how you get on. But with the slow ones, you're trying to hold on. You're trying to keep that contraction to last for as long as you can manage, okay? Just to improve the endurance and to ensure that the slow fibers, we call them the slow fibers, are working, and you're really working the slow fibers. So remember that there are two types of pelvic floor contractions. There's the fast contractions for the fast muscle fibers, and then there is the slow contractions for the slow muscle fibers. Okay, so I employ that you start practicing the exercises. Remember, when you're doing your pelvic floor exercise, nobody should know that you're doing your pelvic floor exercise. So if you're doing your exercise and your shoulders are coming up and you're squeezing, your pelvic floor muscle, as I showed you, is not up on your shoulders. When you're doing your pelvic floor exercise and you're really holding your breath, your pelvic floor muscle does not incorporate your breathing. There's part of the breathing mechanism with it, but you shouldn't really be holding up when you're doing it. Remember, as I said, the pelvic floor muscle sits on the floor of the pelvis. So when you're doing that exercise, this is the area that should really be contracting. Your thigh muscles shouldn't be contracting. Your bum muscles, which most women would make a mistake of doing, shouldn't be contracting as well. So it's really, really specific. Okay, take your time. Okay, practice, practice, practice. All right, don't give up on it. Lie down, knees bent, legs far apart, and start isolating and getting those muscles nice and strong. Okay, all right, so uh, we're wrapping up now the video, and I just encourage us as women. It's, you know, this is things that people don't talk about. This is a topic that people hide. This is a topic that that women are kind of ashamed to discuss. But I employ that you start your exercises now. That, and if you're not getting anywhere, contact a women's health physiotherapist to explain it further, and maybe even to book a one-to-one session with you. Okay, so I hope you now have a better understanding of your pelvic floor muscle. It's just like any other muscle, it can be rehabilitated. We can strengthen it up. Okay, there are tips and there are different rehabilitation equipment that we can use to get that muscle strong and to get you back into shape again. So I will employ women to be proactive at this. Start the exercises now, no matter how young you are. Start the exercises now, no matter how old you are. Every woman should get going with the pelvic floor exercise. Okay, thank you very much for your time. Have a good day. Take care. Goodbye.